Hello, good evening and welcome. This is 6 p.m. Prime on India Today. I am Ankit Tyagi. As always, right at the top of the bulletin, let's bring you up to speed as far as the coronavirus march in the country is concerned. What's the big picture? Where are the big numbers coming from? At this point of time, 56,342 cases have been reported from the country. More than 1,800 deaths have been reported as well. 1,886 deaths countrywide. The numbers in the last few days have in fact taken a very quick pace, a quick jump as far as the rate is concerned, growing rate is concerned. Where are the big numbers coming from? Maharashtra is the worst state with 17,974 cases, 694 deaths being reported from Maharashtra. Gujarat has crossed the 7,000 barrier. It is at 7,012 right now. 625 deaths from Gujarat, and Delhi just short of 6,000 mark at 5,980 cases and 66 deaths. This data was in fact updated at 5:30 p.m. this evening. There is a lot to talk about on the show today. We have been hearing what the government is doing. We've been hearing how there is lack of PPEs. Sometimes the Prime Minister comes out and says, let's honor the COVID warriors. But this evening, in fact, that right at the top of 6 p.m. after we are done with the headlines, I want you to take a look at the stories of the doctors, the perspective from the other side of that cumbersome PPE. What is it that the doctors, their challenges, what is it that they want, the challenges that they are facing? That is going to be our top focus on 6 p.m. Prime. Let's first give you the larger sense of where we are standing in our COVID war. The numbers we brought you right at the top, but just take a look at a few very interesting data points that in fact gives us more information about where India and how are we faring as far as the country goes. Now, I just want you to take a look at these three, in fact, lines because a lot is being spoken about whether we are peaking in June, what is happening to our curve. What you see right now here is the red line, which in fact is the current the rate of growth of the COVID-19 cases in the country. So we are at this point of time about 6% growth of the daily cases. And if you take this projection, then till June, in fact, it is expected that the numbers are going to cross the end of June, 30th June. In fact, if this keeps going at the same rate, the numbers are going to be somewhere around 2,35,510 if we keep growing at the current stage. And this is what we were told on 23rd of April, that the numbers will start coming down between mid of May. In fact, the number said that it could come as close to 0 cases daily. But at this point of time, the number of cases are only going up. This data was of the Niti Aayog, and what we were told is that these numbers could come further down to the mid of May, almost to 0 cases per day now. I just want to now shift focus to the top story that we are taking today. While there are doctors, we keep hearing about what doctors should be doing, what the state government is expecting the doctors to do, but from insults to threats to harassment and even physical violence, our COVID warriors have taken it all and are still working on the front line. They have not stepped back. They are being debarred. People don't want them to go back to their home. They continue to be on the forefront, even putting themselves and their families at risk. All that remains for them is their sense of duty. This evening, we'll try and bring you the other side, the perspective from behind the cumbersome PPE, from the people, those who are wearing the white coat, the issue that they battle, the stigma that they are facing, and what still keeps them ticking.
While some of them were hailed as heroes, welcomed with flowers and applauded,
देश के कोरोना योद्धाओं, हमारे डॉक्टर, नर्सेस, सफाई कर्मी, पुलिसकर्मी, ऐसे सभी लोगों का हम सम्मान करें, आदर पूर्वक उनका गौरव करें।
Others in various parts of the country have been chased, insulted, beaten. Some have even denied dignity in death. As the number of COVID cases surge, it is doctors and other healthcare workers who are leading the battle against the virus. All this at great risk to their own lives and that of their families. What is pathetic is that while doctors and paramedics are doing all this, they are facing prejudices from the very society they are protecting. A housing society in Ghaziabad, Uttar Pradesh, has even banned the entry of doctors and other health staff who are living within the complex.
Demand that government should focus on the preparedness. They should provide the facilities to the healthcare providers who are the frontline warriors in this COVID pandemic.
Social ostracization is not the only problem they are facing. Many state governments have imposed restrictions on their movement. Healthcare workers have constantly been raising the issue of lack of proper personal protective equipment. There have been several instances of harassment and even attacks by patients inside hospitals and outside. In Delhi, 418 workers in 33 hospitals have tested positive for COVID-19. Every 12th positive case in Delhi is a healthcare worker. In Mumbai, over 300 healthcare workers and doctors have been infected. Despite all this, doctors and healthcare workers have just one appeal.
We are all extremely concerned about our own health also when we go to work, when we don those PPEs, and we take all the precautions that we can to try and reduce our risk of getting infection also.
On behalf of all the healthcare workers, I am appealing to you to understand our plight, to comprehend our apprehensions, and hold our hands in fighting this community virus.
Doctors out there in the front line of the COVID war, working against the odds. At a time when India needs the help of every doctor and paramedic, they should be treated as saviors. Hollow applause from balconies is just not enough. Bureau Report, India Today.
And we'll just put out few graphics for you because today there have been 45 CATS ambulance workers, drivers, paramedics, those who have also tested positive in Delhi. So the numbers are staggering. They are putting themselves out there for us. They are still the worst impacted, the worst exposed as far as the virus is concerned. How are doctors being pushed into a corner? There are, in fact, threats. They have been asked to treat patients free of cost or face action. Point example is the district administration of Amritsar, where the doctors were told not to charge money from the patients, those who are even coming in private clinics, or else they would face action. Report for duty or face cancellation of their registration. There are many doctors, specialists, those who are in fact working on other cases. Now they have been asked to come to the COVID-19 cases, and if they don't do that, for example, in Maharashtra, they have been threatened that their registration would be cancelled. Don't travel interstate to places of work or to their residence. And the classic case is what is happening in Gurgaon, between Gurgaon and Delhi. Doctors every single day are stuck there, not able to go to their work. If you are a doctor living in Gurgaon, you are not able to come to Delhi. Or if you are a doctor who lives in Delhi and works in Gurgaon, you can't even do that. Fear of doctors being potential COVID carriers. And this story we have highlighted so many examples. While we clap for them from our balconies, if you have a neighbor who is a doctor, you are scared of that person. You don't want him to come back to their residence because you think they are the ones, those who will be potential COVID carriers. Work without salary or meager stipend. I mean, there have been protests which are going on of junior doctors in Karnataka and other places of the meager stipend that they get. And right now, they are the backbone of this entire fight against COVID-19. Face legal action or over complaints over lack of resources. if you are a doctor and if you write a letter, or if you say that there is, you are not getting proper equipment, proper protection equipment or any other resource, high chances of that being corrected is, chances of that being corrected is almost close to zero, but you facing a departmental inquiry or some action are absolutely high. So if you look at it, there are a lot of reasons. And then the personal anxiety as far as doctors are concerned, the kind of cases, the environment that they are working on, the stress which doctors are working in. I just want, in fact, for us, all of us, to keep these things in mind, because there are a lot of expectations of doctors, but what are they getting in return? And remember, India, still as a country, we are woefully short of experts, of doctors in the medical field. So is it just showering rose petals or clapping for them for camera? Is that enough while we remain silent when they are discriminated? What do our doctors want? What do our COVID warriors expect from us? And what are the challenges, the issues that they face? Let me now go across to two very senior doctors' voices, those who have been, in fact, putting this point forward. I'm being joined by Dr. Rajesh Deshpande. He is a neurologist and he has extensively written on this kind of threat culture which is working right now, and what doctors, in fact, need in a critical situation, because they are the ones, those who are, in fact, we need the doctors. Otherwise, pandemic or not, it is going to be a huge issue. We are also being joined by Dr. Renu Sehgal. She is a gynecologist at the Artemis Hospital. Dr. Renu, Dr. Rajesh, thank you so much for joining us here on India Today. Pleasure to have both of you here. I want to start with you, Dr. Deshpande, because I was going through the blog that you have written. Quite a scathing blog about how the doctors are being pushed into a corner at a time when possibly the government and the society as whole need to be backing them completely. What are the apprehensions, sir? If you could just highlight it for our viewers, things that you've written in your blog.
Thank you, sir. I'm first thankful to the Prime Minister for appealing the people to follow dignity, to respect the doctors and other healthcare professionals. But I would also like to see it translated into the admins of the rest of the governments also. Some of the state governments have used the language of threatening. This is like when a fireman is fighting fire, you tell him that I will suspend you if you do not do what I want you to do. We are the doctors who are dealing with COVID and corona pandemic. Nobody should speak the language of suspension and threats to us. We are the ones who can handle this. Don't tell us how to handle this. Involve us in the process. We will be very happy to bring our country out of this pandemic. But don't use, please, the language of suspension and threatening. It is useless. Nobody will fall to this kind of tactic. You have failed as an administrator to give the country the right kind of healthcare setup, and the private practitioners have been covering that up, doing their best to do what they can for the poorest of the poor. So in such kind of emergency, don't use the language of I will suspend you, this is the language used by many governments, and it is very pathetic that in the time of pandemic where all over the world doctors are being respected, India is using the language of threatening and suspension. This is very shameful, sir.
Dr. Sehgal, you are a gynecologist, and we were discussing earlier, and I also made that point in the report that we put out. There are problems. I mean, there are hurdles being created for healthcare professionals. You live in Gurgaon. If you want to come to Delhi, and if you're working in Delhi, the borders are sealed. Every single day there are scenes of chaos, doctors seen pleading, let me go to my work or let me come back home. How, as a healthcare professional and especially a gynecologist who possibly have been dealing with patients, you have had patients for many, many months, how difficult is the situation right now?
Thank you for having me on the panel. I'll tell you what is the specific situation. Is my patients, who are, especially the pregnant patients, I've been treating for the past 9 months, 8 months. Comfort, a sense of that is built up in these 9 months, and basis
Ma'am,
in the time when
Ma'am,
they need
there is
me.
little problem with your audio. May I just request you to, in fact, just just take a moment so that you can just shift to some someplace else where we have a better connectivity, because right now your audio is slightly patchy. We are not able to understand exactly what you're saying. While we fix that, let me just quickly go back to Dr. Deshpande. Dr. Deshpande, the other issues that you have also raised, and this is something that the apprehension, or at least the image that is being created, that private doctors, private practitioners are at this point of time only focusing on their bottom line, trying to make a lot of profit even at a time of a pandemic. What do you have to say when people in fact tell you that, even the doctors here, only the government doctors are working? What about the private practitioners? They have completely raised their hands as far as this situation is concerned.
I will ask anyone who is alleging this whether he will risk his life to earn a profit of, how much profit can a doctor earn? 1,000 rupees. Will you risk your life for 1,000 rupees? We have earned a lot through our practice as respect by saving lives. We are not working for 1,000 rupees or 10,000 rupees. We are going to earn after the pandemic also by our normal ethical practice. Why will we risk our life for a few thousand rupees? So it's a baseless allegation, and such kind of allegations are in fact promoted when the administration uses the language of suspension and threats to doctor, which should go away. I also want to thank some of the society members who actually are helping out doctors who cannot afford PPEs, the protective equipment and N95 masks. Not all people are driving out doctors. Some of them are actually helping. Some societies are actually helping doctors by buying them PPEs. We are very grateful. The Indian medical profession is very grateful to such people who are helping doctors. The third thing is that the price of PPE, let us consider the price of PPE. One N95 mask, which costs around 45 rupees to the government, when it is sold to a private practitioner, suppose I want to go to the hospital tomorrow, I have to buy the same mask at the price of 225 because the government does not give the doctor a concession to buy a mask for the safety of his own life while treating patients of COVID. So this kind of the GST and all should go away from PP. What's the point when you are forcing doctors to work without any money and remuneration?
Yes.
What is the point of charging 18% GST on masks and PPE? We don't deserve this. Everything should be made
before
free.
Before we go back to Dr. Renu, I just want to understand from you as well, because a lot of people, and we have also seen in few states, doctors, those who are, let's say, specialists. You are a neurologist, there are cardiac surgeons, there are other doctors, specialist doctors. It takes them years and years to, in fact, hone their skill, go through a very rigorous curriculum before they are actually allowed to practice. They are now being put into the frontline duty of corona, of infection, of COVID duty, and so forth. Do you think, sir, at this point of time, there is neglect as far as the other patients are concerned? Other patients, those who may be suffering from other diseases, are being neglected, and hence the doctors are also paying the price. Specialists are being pushed in for COVID duties.
I'll tell it in a very simple sentence, that if one cardiac expert or neurological expert or liver transplant surgeon or any expert from some specialty dies today because of attending corona patients, many 100 patients that he would have saved will die. So for saving a few corona patients today, it is unwise to risk the life of so many We already have very, very few specialties and specialists in India. People travel from rural areas to Bombay and Pune and Madras and Delhi to get the right specialist. If you are pushing them to the front line and endangering their life, of course, every doctor, even a general practitioner's life is as costly as a specialist.
Renu.
But when you are pushing the wrong kind of people to the front line, you are endangering the life of many thousand other patients, which is unnecessary.
Important points being made there. Just for the perspective to our viewers, what goes through a doctor's mind when you see all these reports of people telling you not to come back home, or your colleagues, doctors being beaten up while they are on duty? It just seems that if patients are angry, they are in distress, doctors will have to bear the brunt. If the administration fails in providing resources, questions are asked on them, it's ultimately passed on to the doctors.
Yes. So to put it very simply, and presuming that every Indian is genius class intelligent, I'll not explain my sentence, just put it plainly. There is a lot of jealousy of highly educated people who earn a lot. And doctors are one category like that. And that's why people from
Yes.
different runs of life take pleasure in bombarding doctors, making allegations that are baseless.
Okay.
We don't have time. We are busy attending patients from 10 o'clock in the morning till 11 o'clock in the night. We don't have time to go and explain to stupid people that we are not doing this for money. There's too much
Sir,
risk and too much hard work involved here.
strong, harsh
to do
words,
this
but
for
I can
money.
understand where they are coming from. I mean, I can understand where they're coming from, and Dr. Renu Sehgal is back. Ma'am, I very quickly, we lost you at that point of time. You were just explaining to us the trouble that you are facing every single day. And as a gynecologist who is involved with your patients for a longer span of time, is it difficult right now with your patients? How do they react when you have to tell them that you can't attend them and you'll have to pass them on to a different doctor?
See, that is the problem, that, the patients have built a trust. And for 9 months, they have been with us. They have built a trust. So it is difficult for them to understand why I'm not available when they need me. They are not comfortable if I tell them that I'm referring them to a colleague who will take care, as good care as I'll be doing, but they're just not comfortable. And I did face problems for 3-4 days till I could acquire a pass for me to go to my hospital, because I couldn't attend the deliveries or the cesareans or some emergency procedures that were scheduled.
Yes.
I could go and meet the patient.
Also, you were also telling us about like there are certain rules the RWAs have made. You can't take your car in. At one point of time, they are appreciative of the work that the doctors are doing on the front line, but they are extremely wary when doctors are among themselves, when they have a neighbor who is a doctor.
It's very strange that, all those people who ask for us and, can't call the tallies and are there when they want help, sometimes it's not because they want to help us or they are not appreciative. I think it is the authorities who have created a kind of fear in their minds. It is a kind of fear that has translated down to them. Feel when there is a headline that a doctor has turned COVID positive and he has infected so many number of patients, then there is a kind of fear that comes to the general public. The RWAs are...
Yeah. Very quickly, ma'am, in the end, because I know that you and your husband both are doctors. And as I said in the beginning, that India anyway is lacking specialists, doctors, medical professionals. We are still not to the mark where possibly we should be. Would you want, in a situation like this, where despite putting in so much effort in your education, so many years in your craft, you have to face the kind of stigmas or the kind of problems at a time when doctors should have been, in fact, not only hailed on television, but on literal sense. People should have been behind the doctors completely. Would you want your child to be a doctor?
I don't think most of the doctor fraternity now want their children to be doctors.
All right. Again, there is a patchy audio. But it was I just wanted a good reaction, a quick reaction on that, because it's important to understand the psyche of the people, those who are right now in the front line. And Dr. Deshpande, you've been writing extensively about it. And Dr. Sehgal, thank you so much for sharing your perspective. We are hoping that it's just not about the perspective from the patients. It is necessary perspective from the policy makers, but perspective from the doctors, which can also be included, because it has to be a holistic fight and all of us will have to fight this corona battle together. Thank you so much for being with us and sharing your views on this. Remember the very famous and still anonymous street artist Banksy? He has yet given out a hard-hitting message with his latest artwork. And since we were talking about doctors, I thought it's appropriate to put this in. Titled Game Changer. The piece shows a little boy playing with a superhero toy that resembles a nurse, while figures of Batman and Spider-Man lie idly in the basket. So just don't let it be a show of support with just coming out for television cameras and clapping. Make sure that this support percolates down. The doctors know that we have their back. We are backing them because these are the superheroes, those who are right now fighting the battle for us. Breaking news coming in. BMC Commissioner Praveen Pardesi has been transferred. BMC Commissioner has been transferred after the COVID situation in Mumbai went out of control. Praveen Pardesi, current BMC Commissioner, will be sent to Urban Development Department. An additional Chief Secretary I.S. Chahal will be the new BMC Commissioner. Sahil Joshi joining us with more details. Sahil, this decision after Mumbai alone has more than 10,000 cases, and there have been questions being raised on how the city, in fact, is tackling the entire pandemic.
Absolutely. In fact, the Mumbai becomes the first city, has become the first city which has crossed the 10,000 mark. And not only that, the BMC commissioner within the organization was also criticized for not getting into proper contact tracing. In fact, his containment zone strategy was quite a success. But at the same time, the contact tracing, which should have happened with the containment zone, did not happen the way it could have. That is also one of the reasons. You also saw that in last few days, there were multiple videos which were coming forward. The Sion Hospital video, the videos of some mismanagement of the BMC officials, everything clubbed together. Now finally the state government has gone for a major reshuffle at the time of the COVID fight, and not only the BMC commissioner but also the two additional municipal commissioners have also been changed, and new people have been brought in.
Sahil,
so it's a major reshuffle within the BMC hierarchy.
Yeah, Sahil, very quickly,
Yes,
very quickly, is he being made an scapegoat? We were just talking to the doctors, those who are saying whenever the authorities, the administration is not able to provide proper answers, somebody is made the fault person. Is the BMC commissioner the fault person, or they are actually, the government felt that he is not able to control or handle the situation?
Normally the way the BMC functions, the BMC commissioner is a chief of the Bombay Municipal Corporation. The whole administration is run by a civic official, not even the BMC corporators. The BMC corporators body one way reports, kind of give suggestions to the BMC commissioner.
Okay.
But the BMC commissioner is a powerful authority, and it looks like now that the government feels that the way the situation has happened, even after 1.5 months of the lockdown, the numbers are still rising. There is no flat curve which they were planning to achieve.
Right.
Maybe because of that, they want some tightening to be done within the BMC. The administration should have some tightening with respect to the containment zones and other particular issues, and that's why it looks like that this transfer has finally happened.
Sahil, thank you so much. Sahil Joshi reporting there from Mumbai, the city which has reported the maximum number of coronavirus cases and still is reporting cases on a very, very alarming number. So the BMC commissioner becomes the first casualty as far as the administration is concerned.